Is it a meltdown or is it a tantrum? All parents experience both, but how do we tell them apart and how do we know how to manage each? Hi everyone, my name is Nicolao. I'm a board certified behavior analyst, a member of the IBAO and a proud mum of 2. Today I wanted to talk about something that comes up constantly in parenting, education, clinical work, and that's the tantrums and meltdowns. Now, in some situations, these terms are used interchangeably, but from a behavior analytical point of view, they describe very different things. And confusion might lead to ineffective and sometimes harmful responses. So behavior analysis asks a simple but quite powerful question, and that's, what is the function of the behavior? In other words, what is the behavior trying to communicate? Or what does the behavior produce, escape, avoid, or regulate? When we look at tantrums and meltdowns through this lens, the distinction between them becomes much clearer. Now, let's rewind a little bit and let's think about behavior under the umbrella of behavior analysis. Now, if we clarify a little bit, in behavior analysis, behavior includes anything a person does. And that could be talking, reading out loud, singing, crying, screaming, hitting, shouting. It could be throwing a ball or throwing a toy. When we are looking at behavior as behavior analysts, we are not judging behavior as good and bad. We're just looking at 3 main things. We're looking the before, so what happened before the behavior, what we call the antecedent. We look at what the behavior looks like, and then we look at the consequence, meaning, is there something happening after the behavior that's stopping the behavior from happening in the future, or keeping the behavior happening in the future and reinforcing it and maintaining it? Now, the other thing that we look as behavior analysis is there any skills missing? Is there any support that we need to input to help that individual in those situations? Now, if we break down tantrums and meltdowns, tantrums is what we call functionally maintained behavior. So from a behavior analytical standpoint, a tantrum is an operant behavior, meaning it's influenced and maintained by its consequences. So some key features of a tantrum is it often happens when something is blocked or delayed or denied. So when we're asking for something and something is not given to us, it is very sensitive to environmental consequences. It serves a clear function. Usually is under one of the main functions that we use in behavior analysis, which is access to tangible, such as toys, electronics, food, escape and avoiding a demand, or access to attention from a teacher, a peer, a parent. In a tantrum, the individual still has what we call behavior flexibility. What does that mean? It means that the behavior can still escalate or de-escalate depending on what others do, and that's a very important aspect of a tantrum. The behavior may stop suddenly when the desired outcome is achieved, and the behavior might not occur at all in different settings or with different people, meaning it only happens when it works. Now, a good example is a child is screaming, crying, dropping on the floor because a parent told them that electronic time is finished, so can I have the tablet back, please? So we observe all these behaviors. When the tablet is returned, so if in that moment the parent says, okay, here you go, you can have your tablet back, what we'll see is an immediate termination of those behaviors. So those behaviors stop and don't happen anymore. So if we look at this behaviorally, the behaviors were evoked by taking away the tablet, by giving it back, the behavior stopped in the moment. However, there is higher chances that those behaviors will happen again in the future, meaning giving back the tablet is maintaining the behaviors when the situation happens again. Now, it's very important to mention that the child is not manipulative or bad. It just means they found out a way to get what they want using some behaviors. Now, if we flip the coin, we've got meltdown. And meltdown is a breakdown of a behavior regulation. Like in contrast with a tantrum, it is best understood as an operant behavior. So from a behavior analytical perspective, a meltdown reflects a temporary breakdown in behavior regulation, often due to establishing operations, which means that there are things that are established in the environment that trigger a tantrum rather than that what other people do. So in simple terms, the person is no longer responding to the consequences in a typical way. Now, a key feature of tantrum is triggered by overload, not necessarily denial. It often precedes by sensory stimulation, emotional exhaustion, maybe prolonged tasks, lack of sleep, hunger, thirst, illness, stress, being too hot, being too cold. So behavior is less sensitive to consequences. So it continues even when we reinforce it or when the reinforcement is removed. It might worsen with attention or punishment. With a meltdown, the individual is not trying to get something. So the behavior does not reliably stop, like when a demand is removed or when something is given. And what we observed a lot is traditional behavior management strategies fall a bit short and might not be successful. So what that teaches us is that within a tantrum, the behavior is not maintained by social reinforcement. And that's why we need to really think about why punishment strategies, which in behavior analysis, and I'll link another video, punishment in behavior analysis is anything we do after the behavior to make the behavior less likely to happen in the future. So it is not what we have as the normal kind of understanding of punishment, but I will make another video on that. But for the purpose of today, punishment might worsen. So during a meltdown, an individual cannot necessarily process contingencies effectively, meaning they will not necessarily understand things like scolding or restraining or telling them that if you continue doing that, that will not work. It actually might make the behavior worse. It might prolong an episode or make it bigger. It might increase the distress. And it makes the individual feel that this environment, this situation, my caregiver at the moment is not a safe place. And this is why behavior analysts cease to prevent and support individuals regulate, not give consequences when meltdowns are present. Now, again, let's take a step back and how do we tell the difference in the moment? So I'm standing here, I have my kiddo, is exhibiting these behaviors, but I don't know, is it a tantrum or a meltdown? So key questions. Does the behavior stop when the individual gets what they want? Yes, most likely it's a tantrum. No, most likely it's a meltdown. Does the behavior change depending on who's present? If yes, then it's most likely a tantrum. If no, then it's most likely a meltdown. Is the person able to communicate, negotiate, shift strategies? If yes, then most likely it's a tantrum. If no, then most likely it's a meltdown. Did this come after a prolonged stress or sensory load? And you know your kids best, like if there's a history of attending the supermarket and meltdowns happen, then probably the supermarket is an overstimulus environment. So if that is yes, then it's most likely a meltdown. So these are functional indicators and not moral judgments. Now, if we're thinking about intervention for each, let's pick tantrums first, because tantrums are what we call operant behavior, meaning they are effective with consequence-based strategies. We might focus on proactive and consequence strategies, meaning having clear, consistent boundaries, preempting those behaviors from happening. If those behaviors happen, ensuring that we don't reinforce them so we don't necessarily give in. If we're thinking that a skill is missing, thinking about teaching that functional communication, such as negotiating, requesting, using an alternative augmented communication system. Thinking about differential reinforcement of appropriate behavior. Predictable routines and transitions might help. The goal is to reduce tantrums, but in place to have skill acquisition for the young person to be able to communicate what they need and what they want. Now, if we're thinking about what can I do if it's a meltdown, because we've talked about being two different things. The key strategies include like reducing the sensory input, removing or postponing that demand that brings that stress, providing physical and emotional safety, allowing time for that regulation, allowing time for that child to come back to their baseline, and teaching regulation skills outside of meltdown moments, so you'll be able to jump in during a meltdown and try to guide that young person through it. So what we're looking at is antecedent control strategies rather than consequence-based strategies. Why does this distinction matter ethically when we're thinking about those two categories of meltdowns and tantrums? Now, mislabeling meltdowns as tantrums leads to inappropriate strategies, escalation of distress, learning helplessness or shutting down. So the young person learning that nobody's going to help me now, I'm on my own. And misleading tantrums as meltdowns, on the other hand, might reinforce behaviors that we don't want to see, might delay skill development or reduce independence. So we really like to unpick these behaviors and make sure that we identify when we have a tantrum and when we have a meltdown, so we can introduce the right intervention to help the young person achieve to their maximum capacity. So from a behavior point of view, the question is never, is this behavior good or bad? The question is, what is the function of this behavior and what does this person need, instead of using a tantrum and saying, I've learned this behavior works, or using a meltdown saying, my system can't cope right now. So it's all about giving those skills to manage both. Our response should be guided not through frustration or labels, but by understanding the function, understanding why the behavior is happening, using compassion, and most of all, using the science. Thank you so much for joining us. I will link below some more resources and some more links to other videos that you might find interesting. And please leave us a comment if you find this interesting, if you've got any scenarios that you would like us to discuss, and we hope to see you on the next one. Bye.